I'm Elaine Borowski, and I'm the director of our Prevention Research Center here. And we are very pleased to have such a nice crowd. Very excited about this presentation. We're good? So just as a way of intro about the seminar too, while we're having people come in, just a reminder that this is our monthly seminar of the Prevention Research Center. We usually have a wide variety of programs and presentations on research and other areas of linkages that we share with our community partners. I'm actually channeling Dr. Souflaki, who normally does this job, so I will do my best. There was a sign-in sheet at the front end. We'd appreciate if you would, if you haven't signed in, please sign in on the way back out. There's also a list of upcoming seminars there, so please take one if you'd like that. But all of this information is also on our website, on the far right under seminar. And that Susan's reminding me that we are recording this. And so what we just ask, and it's really hard when so everybody open their little cracker thing now, right? Because the ambient noise is what will wipe it out, right? But the key though is that these presentations are recorded and they are up on our website. If something somebody said was exciting, you can go back and do that. You good? All right. You ready?
I can hear them all.
I know, so open them up. Here's what they're There's potato chip bags or something. And I'll take this opportunity too. I think to thank both Susan and Jenna, who's at the door, and Souflaki, who does this work, and just organizing this this seminar. It's a lot of collaboration and coordination of getting these projects or presentations together and then getting them up on the web. So publicly, thank you. And then Jenna walked out, so I won't thank her. But really, it's a lot of work, and we do really appreciate all that goes into it. So, should I start? A few more? What do you think, Susan? One more minute? What else can I tell you about? Let's see. Here we go. Okay. So guys, wait for seats. There's one up here with a table. There's one up here with a table, and there's some back there. So however you would like to do this. Yes, there's one chair here. There's one over here. Thank you. Okay. Thank you. Very well. All right. Without further ado, this is lovely. So I'm very excited to hear this presentation myself. Darcy talks a lot about this project, and to actually hear it now from the beginning to end is a wonderful time for all of us. So this is a project about something everybody calls BCOP, which is Building Capacity for Obesity Prevention, and it's what we hope to do the best here, right? It is the collaboration between the researchers at the Prevention Research Center, partners, public health partners, community partners, and in this case, with the SNAP-Ed program at Ohio State and the Creating Healthy Communities program at the Ohio Department of Public Health. That's a lot of partners to put together a project. And today we're going to hear about this. I'm going to do a brief introduction, but I'm hoping Darcy can also give a little bit of a background. Dr. Darcy Freedman will take the lead on the presentation. Darcy is an associate professor in the Department of Population and Quantitative Health Sciences. We just changed our name. So Sciences, and also associate director here in the Prevention Research Center, and has led this. As those of you do know, Darcy is an expert in food systems. We recruited Darcy here for this particular reason, for really trying to figure out some of the food systems in not only Northeast Ohio, in Cleveland, but across the state, and how do you use much of the expertise that she has in systems level thinking and modeling around this work. So she's going to start, but then I would like to also introduce Dr. Zubieta, who is the director of the SNAP-Ed program in the Department of Human Sciences and Extension at Ohio State University, right? And she has offered statewide leadership to the SNAP-Ed program, and really coordinating these programs of implementation and evaluation and dissemination. So welcome to the PRC. Also introduce Dr. Lee, who's a postdoc here at the Prevention Research Center, and has done a lot of work, and let me see here, research associate and postdoc, committed to health disparities research And much of the work has been in developing web-based diagnostic tools for community readiness and practitioner capacity to really implement nutrition and interventions around obesity prevention. And the soon-to-be Dr. I'll get it right, Ngendahimana, yes, David, who is a PhD candidate in our department and has worked on this project as a pre-doc, where his responsibilities have been the statistical support for the program and engaging other research activities around food environment systems to really build capacity for obesity prevention and treatment. So without further ado, I'd like to thank the panel and introduce Darcy to take a slide.
So thank you guys for being here. Great crowd. I see a lot of familiar faces and a few new faces. So thank you for being here. Just a little bit of orientation, because we actually don't have these statistics in the slide. For those of you that aren't aware, Ohio ranks the 19th highest obesity rate in the country. In 2016, 31.5% of the people in Ohio were obese. Absolutely shocking to me. That's almost 3 times the rate that we had in 1990, when we had about 11% obesity rate in Ohio. So something's going on, something has changed. Just another frame of reference, when we look at obesity in our state, it disproportionately affects people of color and low-income populations, and hence the focus of our project here, Building Capacity for Obesity Prevention, is very much targeting low-income populations across the state, or those people receiving supplemental nutrition food assistance benefits, or formerly the food stamp program. Another little bit of context, and Claudia will go into this a bit more. Ohio has the 8th highest rate of SNAP in the country. In the month of June of 2017 alone, almost 750,000 residents in our state received SNAP. In that month alone, that was about $183 million in the economy of this state with SNAP benefit dollars. Just as a frame of reference, that was a 6.5% decline in SNAP rates for our state from 1 year before in 2016. So while we have very high rates of SNAP, I think if you look at the demographics of the state, we have high rates of poverty. And we are, the economy is improving for some people, and some people are able to roll off, but we still really do have a significant portion of our population in the state who are impacted by the SNAP program. A little bit about our presentation. We're going to give you some orientation to SNAP Ed. Anna Claudia will provide that. I'll come back and talk more about our study, BCOP. The idea of policy system environmental interventions, or PSEs, which are evidence-based strategies for obesity prevention. We'll then go into the methods that we've been using since 2014 to develop diagnostic tools to assess readiness and capacity for implementing different community nutrition interventions. Our project then moves into dissemination phase, and we disseminate via a website. So I'm going to talk a little bit about that. And Eunlye is going to provide us more information about early response to our website and some of the findings that we're looking at. An underlying belief in our study is that while evidence-based interventions are really important and we should start there, one size does not fit all. And we need to figure out the right intervention at the right time for the right place and the right community. And that really is the ultimate goal of the BCOP project. So I'll end with a little bit about where we see this moving forward in the next year or so. Oops. We are funded by the CDC through the Ohio Department of Health, as well as through the USDA through the SNAP Ed program. Okay.
All right, well, it's, let me see, this is what I use. Good morning or good afternoon, not sure, right in the edge there. I'm Ana Claudia Zubieta, and I am, Darcy was mentioning, the director for the SNAP Ed program in Ohio. The program in Ohio is based at Ohio State University, and it is kind kind of implemented throughout the extension system, so in the counties throughout the state. You all are very familiar with the SNAP program, being around for about 50 years and the largest safety net for hunger in the country. It plays a vital role in alleviating hunger and decreasing food insecurity among U.S. And the United States. And it has been shown in studies that USDA have shown that actually participating even for only 6 months in the SNAP program has been linked to a significant decrease in food insecurity in those participants. So the Supplemental Nutrition Assistance Program is it's a nutrition program that supports the SNAP program, and it SNAP's role in addressing food insecurity and hunger. In addition, it aims at improving nutrition and preventing or reducing diet-related diseases like obesity. The general goals of SNAP-Ed are to improve the likelihood that individuals who are either receiving SNAP benefits or eligible for benefits will make healthy food choices within a limited budget and choose physically active lifestyles consistent with the dietary guidelines for Americans and My Plate or whatever food guidance it's being presented by the USDA at that moment. So our program is its backbone, and all the curricula that we use is based on USDA dietary guidelines for Americans. So we target pretty much the whole range of ages, starting at age 3. But our main target are individuals who are either eligible or receiving SNAP benefits. How is SNAP-Ed implemented specifically in Ohio? So this is a program that exists throughout the country. In Ohio, we have 3 approaches as we implement SNAP-Ed. Our first approach, and the more traditional approach for SNAP-Ed, is targeting the individual, so direct education at the individual level. We mandate as a state that our programs are at least series of 3 lessons based on some research we done. It takes about 3 lessons to have a little bit of behavior change, minimum behavior change. So our program is specifically the series of minimum of 3 lessons, and each lesson it's a minimum of 45 minutes. So that's kind of the structure of the direct education. We also have approaches at the population level, and this is a more recent part of our program for SNAP-Ed, which is the PSC interventions, or policy systems and environmental changes. And I'll talk a little bit more about that, but I know Darcy will be talking a lot about that later. And the third approach that we use is a social marketing campaign, and this is the newer piece to our program. The social marketing campaign, Celebrate Your Plate, is another approach we're using to target at a population level as well, community population level. This is the map of Ohio, of course, and those are the majority. We are in about 82 counties in Ohio. We just received notice that we need to be in all 88 counties by our funders next year. So that is going to be part of our work as we prepare for our fiscal year 19 plan as we speak. But we have grown a lot, and we used to, when I started working in this program about 10 years ago, we were in about 50 counties in Ohio. So we have done a lot of growth. And so this is direct education kind of numbers, but as you can see, these are programs, direct education programs that we've been doing, and I put a slide here from fiscal year 13 to 17. You can see that our programs have grown largely the same with the reach of individuals from fiscal year 13 being just a little under 100,000 to now in 17, which is last year, close to 400,000 individuals are touched by the SNAP-Ed program. This is a huge effort and a huge need, as Darcy was sharing some of the statistics of SNAP recipients in the state of Ohio. Okay. So the second approach I was mentioning, policy systems and environmental changes, it's newer to SNAP-Ed. This is something that individuals like you in public health have known for decades, that you need those interventions in order to help individuals after they learn and they want to change those behaviors to go to the communities and find those resources available to them. It took us, or it took USDA a little longer to realize that and to say, okay, and to be honest, really, to make changes to huge programs like this takes time, right? So the evidence was accumulated when they finally said, okay, let's move into PSE interventions. Around 2014, 15, we were pretty much mandated to start doing PSE interventions. And here we are, really crazy trying to train our staff and explain what these are as we are learning it ourselves and trying to figure out, how do you evaluate a PSE intervention? So we had all these questions in mind. We were starting to work with we have about 150 staff throughout the state, and individuals who are our educators. We call them program assistants, but pretty much they are the ones educating and doing the education at the ground level. And so right around that time is when we were connected through individuals at FNS were coincidentally at a conference that Darcy Freedman was at, and they, based on her interest in PSEs and food systems, they were like, oh my gosh, you have to meet these people that work with SNAP-Ed. So collaborations are great, could be great. Collaborations could also be very challenging depending on where you are as a program. Like, some people want to work with SNAP-Ed, and I have many times have to say, we cannot do that. And I have to tell PAs and individuals throughout the state, we cannot do that because we have lots of regulations. So that I'm not being very collaborated, right? I'm being like, and people look at me like, well, this is our guidance. But it didn't work that way with BCOP and Darcy. It was a perfect match. It was like someone who had all this research experience and wanted to do all these things. And here we are with the need to also do things because so it was a perfect collaboration, I think, because of the individuals and the needs we all had, but also it was a perfect timing too. And it has given us tons of great things, information, and lots of things that are going to really take us and take Darcy and her group far, I think. I mean, she's already have gotten a lot of papers, a lot of, this big grant from that too. So basically, so now I'm kind of was saying, okay, so this is kind of how we started working with them, based on this need for us to do PSEs. We have been, since then, as a state, doing very mindfully PSE interventions. Some counties have a much more natural situation where things come together easily and it can happen. Others are like, that would never happen in my county. So it's where people are, where resources we have, and this is why some of the tools that the BCOP project has developed are so helpful, because not every situation is the same. For example, in Adams County, the PA realized something that I think all of us who have kids in high school doing sports probably have realized is that concession stands at these schools are serving foods that are so not intuitive with doing sports and being healthy. And Adams County, Ohio, it's a county in the south of Ohio. And this PA talked to the schools and talked to some of the different wellness committees in the schools, and the boosters, parents, and they started with this high school to bring in fruits, little fruit cups, in addition to everything else they sell, little trays of veggie trays, and cheese strings. And that high school, especially the veggie trays and the fruit cups, became a hit. And then other high schools wanted to do it. So this is happening in Adams County. And you may say, well, it's a tiny little thing, but those are the changes that really make things possible for people. Because I have to say, I go to my kids' games, and there's nothing I could eat there if I'm hungry. There's just nothing I would choose to eat naturally. So even if I want to do it, you have to have the environment available, things available to us and to individuals that are receiving SNAP benefits as well. So the third approach of and I know I'm just really saying a lot and very briefly, I just want to give you a quick overview, but I'll be available for questions if you want to talk later too about specifics with SNAP Ed. But this is another very exciting thing we're doing, and again, it's another intervention that SNAP Ed is taking a lead on together with our partners, Public Health, Department of Aging, Department of Education, FNEP, which is another nutrition education program at Ohio State. It's a statewide, and the food banks, Mid-Ohio Food Bank. We're working with WIC and the Department of Health and creating healthy communities as well. We have developed a social marketing campaign, Celebrate Your Plate, to enhance the nutrition education that we're teaching in our classes. So for those of you that are, I'm sure everyone is familiar with social marketing, but I just want to make sure that I stress that in addition to social, it's more than social media. We are using social media as one of the vehicles to do the social marketing campaign, but we are using also other means to communicate the campaign that are not just social media. And we're doing that twofold. One is we're statewide materials, and those are materials that we have produced for our program assistants or educators throughout the state to give to their participants in their classes. So enhancements, nutritional enhancements, basically things that they can use when they go home to cook with or to plan with, like a list of like notepad to make a shopping list, things like that promote the campaign, but also promote the messages that the campaign has, which is to increase consumption of fruits and vegetables, specifically in families with young children. So that's an example of the statewide materials. We have a Facebook page, and we also have a pretty nice website for the Celebrate Your Plate campaign. So those things are statewide, and the other way we're doing this rollout of the campaign is with paid media. And the paid media is it's going to start being rolled out next month in April, and we have divided the state in fours, and we're concentrating in a quadrant at a time to kind of concentrate our resources with paid media, because it is paid media, so it's expensive. And the way we're rolling it out is starting in the northeast part of the state. Like I said, in April, we were moving to your area in June, and then we would wait till the next fiscal year in 19 to start the rollout in probably closer, more in the winter of 19. And then in the spring on the southwest. So this is kind of the way we're rolling it out for the paid media. I'm not sure if I spoke too fast, but it seemed like I probably did. But I just want to end by saying there's many ways we can we can implement programs like this. But I have to say that there's, in our case, in doing nutrition education, in addition with the social marketing campaign and the PSE changes, has proven a lot more effective than either one of those three approaches by itself. And now I'm going to let Darcy continue. Again, if you have any questions or want to talk more about SNAP-Ed, I'll be happy to do it afterwards.
Thank you, Claudia. I'll just give a little bit more context to the way that Anna, Claudia, and I were able to first meet, and that is really because we are a prevention research center funded by the CDC. We're one of 26 PRCs, and we are able to be a part of a network of applied population health research centers. So Elaine could have talked about all of that. Elaine is the director of our center, but because of that, we get to have a lot of opportunities to interact and have this amazing connection here back in our state because of a meeting, a national research network meeting through the PRCs, where I heard about the work going on in Ohio. And so, you know, these things sometimes we talk about collaboration and connection, but a lot of times that, you know, these supports actually allow us and facilitate the ability to do this kind of collaborative work. And our focus as a PRC is to do applied population health research. And so it's not about getting a paper in a journal, which we think is absolutely important and so key to changing the field, but it's really about getting the change in the practice. And so it's hard to make that happen if we don't have a cross-sector collaborative model to the research. So that's exactly what we use here in BCOP. It's a researcher-practitioner partnership, and you can see our three main partners with the Ohio State University SNAP-Ed and then the Ohio Department of Health. Our team, and it's a little bit backwards of presenting, but our team, amazing team here, and super thankful that Anna Claudia came up from Columbus to be with us today. But we have been a training ground for doctoral students, undergraduate students, graduate students. We have partnerships with our collaborators at both of the institutions who are also key to the team. Our project started in 2014, so our team has evolved as the project has moved forward. The ultimate goal of BCOP is to create assessment tools and community readiness and capacity to optimize implementation of nutrition-related PSEs, policy system environmental interventions, to promote healthy eating and prevent or reduce obesity. And this cartoon, we think, is such a good capture of what we're about in BCOP. As Anna Claudia said, at the policy level, there was a mandate that SNAP-Ed had to do something differently. And in this case, they had to do PSEs. And we know that those are evidence-based, and they're super complicated, and we know potentially what the outcomes would be on the other side, but there's a big black box between what we're told to do and what we get at the end of that. And we're trying to give some more details about the miracle in between those two steps. We will confer right now that we haven't gotten at every detail of this miracle. We talk about policy system and environmental change. Policy change being changes in laws, ordinances. It could be in a government institution, or it could be in an organization like a school or a church. Systems change is changing the ways that different parts interact with each other. So an example that we think about in our work would be, how would you change distribution systems to get more locally grown food into a school or a daycare? And then environmental change would be a change to the physical environment, building a farmer's market or changing the corner store, or to the social environment through something like a social marketing campaign where people live, work, learn, play, and pray. These types of intervention strategies are considered to be evidence-based. There have been recommendations from the Institute of Medicine and the CDC for things like encouraging small store owners to offer fresh produce and healthier food through financial or other incentives, or promoting community gardens through zoning policies. So there's a very large body of evidence supporting these kinds of changes as a broader community-based strategy for obesity prevention. And in our particular project in BCOP, we focus on 4 right now. So the 4 PSEs that we target are farmers markets, healthy eating in childcare, healthy food retail, and farm to school. And I'm going to give some examples of these. We picked those 4 because not only are they being recommended by numerous organizations, like I said, IOM or the CDC, but also the SNAP-Ed toolkit and guidance was really promoting those as key opportunities. And we are hearing a lot of interest in the state on those 4. So when we talk about farmers markets, this could be something like getting farmers markets to have EBT machines to allow SNAP benefits to be transacted there, or having incentive programs, or developing models to get more vendors into the market space to diversify the market. Healthy eating in childcare would be including parents in childcare menu planning, or starting school gardens, limiting sweetened beverages and fried foods. In terms of healthy food retail, healthier food options at corner stores, advertising prompts. And then farm to school, this could be promoting a school garden, salad bars in schools, getting more locally sourced food into the school cafeteria. So our approach to this project of figuring out the gap between what we want to do, what we know we're supposed to do, and how do we tailor that to the local process, we used a multi-phase consensus modeling project. So we felt like it was important to learn from people who are on the ground about what they thought would work, rather than coming in and saying, hey, we already have an understanding of how this should work and we're going to tell you what to do. So our first phase, we did a qualitative study, and we interviewed 194 SNAP-Ed and Creating Healthy Communities practitioners. We actually targeted 9 counties throughout the state of Ohio to have both rural and urban representation. And we also interviewed, in that process, we did 18 in-person interviews and 23 focus groups. The interviews were with the SNAP-Ed and CHC practitioners, and the focus groups were with SNAP-eligible population, as well as people involved in the community coalitions related to the Creating Healthy Communities. From the qualitative data, we reviewed the data, we looked for themes, and we looked for core concepts that were coming out, and we used that to develop a set of indicators. And indicators would be, a statement that would operationalize what somebody said was important in terms of implementing these different interventions. And that was a very iterative process, a lot of back and forth, but ultimately we were able to come up with a set of indicators related to themes that we then went to 4 different expert panel conferences to build consensus. And David is going to go ahead and talk us through a bit more about this process and how we prioritize different themes and indicators.
Yeah, so after this second phase, there's a lot of information, a lot of indicators that we had. So there was a need to come up with a method to synthesize this information in a way that would help us identify the most important indicators and also weight themes. So we did that by convening a panel that consisted of experts in policy, system, and environmental interventions. So these are people, for example, who are running or who had started farmers market and had experience, or who are involved in programs to improve community nutrition, especially in low-income communities. So these are people who are experienced in this in each PSE READI that we're looking at. So we had four panels, each looking at a specific PSE READI. The activities that were involved in this consensus modeling conference was essentially sorting and ranking indicators and also weighing themes. So the way it was done was that we provided this panel with a set of indicators that we had collected from phase 2. Then the idea was for them to sort these indicators into themes. Now we gave them a definition of each theme so that they would know which indicator was supposed to go where, their perception of which indicator was supposed to go where. Then within each team, they were supposed to select the three most important indicators, then rank them. So the first indicator was deemed to be the most important, second indicator, second most important, in that order. Then we gave, after that, we also wanted them to weigh the teams. And the way that was done was that we provided them with 25 chips, and they were supposed to distribute those chips across the team so that the most important team had more chips and the least important team had the fewest chips. After collecting that information, we actually shared we built as like summary statistics and shared it with the people in the panel so that we could invoke more discussion so that we get more feedback. Then using that feedback and the information that collected from the expert panelists, we came here at PRC and convened another meeting because to go through the feedback we had gotten, because even after synthesizing this information with a group of experts, we still had a lot of indicators. So for each survey, we still had a lot of indicators. Since the aim of this project is to actually develop these surveys that can be used outside by practitioners, we don't want to overwhelm them with a lot of questions. So we still had to refine these indicators, first of all by reducing the number of indicators we had for every PSE ready, and also looking at the feedback and refining the language and developing also response option for each indicator. And by indicator I mean a question. So we had to develop response to this. Again, this process was quite iterative. It was not a linear process because by reviewing the feedback, we realized that we had, for example, to come up with new indicators. We had to merge some teams, so we had to go back to a select set of experts to try to get an idea of how to weigh them. So it was quite iterative. It was not linear. The final phase here was pilot testing. Now, this pilot testing can be looked at as having occurred in two phases. The first phase is after developing these indicators. We wanted to know if, for example, it made sense, the language made sense to practitioners who are going to use this survey, how long it would take. So that was essentially first under content validation, and it included about 15 experts. Now, the thing that we were planning to disseminate these PSE readies using a website. So we also had another kind of pilot testing to see how this website, how receptive this website was, or how people were using this website, if they're able to navigate between pages, find the right information. And I think you'll talk more about that. So each PSE ready was organized in this way. It has a hierarchical structure, as you can see. At the top level, we have the PSE ready, that is the survey. But under each survey, we divided the indicators into teams. So a survey could have like 5 or 6 indicators. Then under each, teams. Then under each team, we would have a bunch of indicators. Now each team had a weight, and also each indicator had a weight. Now during the pilot testing, we realized that people are not so much interested in how they scored on the PS ready, but they were more interested on what do I do, what can I do. So we were more interested in generating recommendations. But this was also important to have this structure because we get more granular understanding of the level of readiness at the indicator level, at the team level, and the overall level. And that way, future research can be done to understand how various teams interact with each other, what are the correlations, and you can do so many things because you have things that are quantified already and at a granular level. Now, the important thing is how were we generating the recommendations? Now, this again was like in 2 phases. The first phase, which I'm presenting here, is after the person had already gone through the process of establishing an account and doing all the things, and they go to the next part of taking the PSE ready, they are prompted to answer some questions. So for example, you can see that there is a set of questions here and the possible response options here. As you can see, this was on a 4 Likert scale, but we had a don't know option. The next step was we would map these responses to a numerical value. So for example, if you responded not at all to a particular indicator, that was mapped to 0. then slightly was mapped to 0.25, and extremely, that is a perfect score, was mapped to 1. Then we generated weight numeric scores, and this essentially, we took the numeric score that we got at the previous stage, then multiplied by the team weight, and then the indicator weight. The next thing was to compute what we call the lost indicator score, essentially trying to understand how much effort you need to put on a particular indicator, like how much is left. So this was, we took the maximum indicator score, we subtracted the weight in the numeric score. The maximum indicator score essentially is when you get a perfect score, extremely, you score extremely. So it will be 1 times team weight times indicator weight. That is your maximum score. Then we subtract the weight numeric score, the observed score that the person got. Then we get the lost indicator score. After that, we ranked all the indicators and then selected the top 3 indicators. So the first indicator means that is the indicator that has the most lost score. So that's the most important thing that we should be focusing on. Now, using these 3 indicators, we are able now to go and query our database. And the way we query the database is essentially to go back and look at these 3 indicators and look at what was the response you gave to these 3 indicators. So if, for example, you gave don't, no, not at all, and slightly, we generate a recommendation that classifies you as, that identifies you as somebody who is still at the beginning of doing this PAC ready or doing this intervention. So we give you a recommendation that is targeting a beginner, so it's a low recommendation. If you're very high, that means you're doing something right and you should continue to be doing something. So we look for a recommendation that is tagged as high. Then we use these levels of recommendation to query the database. And then we generate a report and our report consists of 3 recommendations because we have 3 indicators, remember, and each recommendation is also tied to a set of related resources that you can go to and gives more details. Now to learn more about the methods that we used here, we published an article in the Translational Behavioral Medicine journal, and you can review to learn more about our methods. Just to highlight a few more numbers here, of the 4 PAC ready, Farmers Market had the most questions, 30 questions. It had also the most theme, and followed by health eating, child care, healthy retail, healthy food retail, and farm to school. As you can see, Farmers Market had both the majority themes and the largest number of themes and largest number of indicators. And this could be explained by the fact that when you're establishing a farmers market, it's a little bit more complex. There's so many things that go into establishing a farmers market, or maybe sustaining that farmers market relative to these other interventions. We had a total of 10 themes, unique themes across all the 4 PAC ready. Now some of these themes were universal or occurred across all the PAC readies. So for example, organizational and practitioner capacity, network and relationship occurred across all the 4 PAC ready. Some were specific to specific PAC readies. So for example, child care capacity was specific to health, eating, and child care. And then you have corner store awareness and perceptions being specific to healthy food retail. Just to highlight the most important themes and indicators that we obtained after going through all the 5 phases. For farmers market, the most important theme was for farmers market and health, eating, child care. The most important theme had to do with the organizational and practitioner capacity. And the most important indicator had to do with availability of sufficient funds to support PAC readies that focus on these specific interventions. For healthy food retail, the most important was corner store awareness and perception. And it's worth to note that these perceptions were not necessarily from consumers, but people who own this retail. Like, how does that affect their bottom line? So that was what was most important. Then for farm to school is essentially how these rules and guidelines at school, are they supporting the PAC ready that we are trying to establish at a school? I think that's it.
So just a brief a little bit about how we translate this out in terms of dissemination. So as David showed you, and you can imagine, it's a fairly complex computational model underpinning our tools. And you could take this paper and pencil, and you could score it in theory paper and pencil, but what would be difficult would be generating those recommendations, which ultimately is the main purpose of the project. So we opted to go with a web-based portal for dissemination. This is our version 1.0 of the website. We released this in November of 2017. We're actually working now on version 2. So it's going to undergo some updates, but just a few key features. Somebody that would come to this website would actually create a login. They would be able to go to their assessments, and then they could keep tracking that over time. Our idea with the PSE READI is that somebody would come back and maybe take this every 6 months, because they get those 3 recommendations, and then hopefully they've moved forward, and our tool is sensitive enough that even if you've made a slight movement, it would then generate some new recommendations for you. And just to kind of draw out a bit more, this is an example of the recommendation and how it links back to our qualitative work and expert panel. So this very first recommendation, begin to make your budget support farmers market PSE projects, it's related to the theme organizational and practitioner capacity. That's the exact indicator, and in this case this was a low response. And so you have some text there, and again, if you've never done this before, we have a compendium of resources on the website of over 1,000 resources out there to support PSEs. It is not for lack of toolkits. There are so many toolkits out there, but if you don't know where to go, those toolkits really aren't helpful. So you can see in your recommendation, go to page 65. That probably would be a good place for you to start. And those in red are links to websites that would be helpful. Here's another example, work to assess and improve farmers market accessibility. This one has to deal with issues around transportation, and this would be somebody who scored medium. And I think it's really interesting, here we would be directing you to resource the fresh food bus. I mean, that's pretty cool for this community where they're saying, hey, we've got this great resource, but people can't get here because of transportation. And then the third example here, same idea around fundraising and budget needs. This is somebody who would be scoring high. And in this case, it's not get your first grant, but it's really thinking about sustainability and how do you continue to fund this work over the long haul. We did create a number of videos related to the project, and I'm not going to do that right now because we are a little bit tight on time. I'll come back to it at the end. But one thing that we decided as a part of our dissemination strategy is, of course, all the words are helpful, the website is helpful, but sometimes you want to see in the words and faces of people like you, how have they actually broken out all the baby steps of implementing a PSE. Oftentimes we have that shiny, amazing story of one county in Ohio, not Adams County, which you gave a great example, but some other county. And the other counties looked at it like, there's no way we'll ever be that county. And it's dead on arrival. So how do you show somebody who's like you, who dealt with a challenge? And so we have 20, about 1 to 3 minute videos that break out, and all of the video story mapping is linked to those 10 themes that David introduced earlier. And so now I'm going to turn it over to Eunlye, who's going to talk a little bit about some of our early findings and around the usability of the tool.
Thank you, Darcy. So between April and December 2017, we conducted this usability testing to collect user experience data from SNAP-Ed and CHC practitioners in 17 counties across Ohio in order to improve the PSE READI tools and website. This usability testing consists of online pre- and post surveys as well as an optional follow-up phone interviews. In total, we recruited 22 participants, and all of them completed the pre-survey designed to know their initial perception of community readiness, beliefs about PSE intervention, feedback on barriers to implementing PSE intervention, and their background information. When our website was launched on November, I think,
8th last year, we asked participants to take their assigned PSE READI based on their preference. And 18 participants completed this task, and excuse me, of 18 participants, 13 took the online poster survey and 4 were interviewed. The poster survey and interviews were focused on getting feedback on the usability of our tool and website, intention to use recommendation provided after their assessment, and any suggestions for improvement of the tools and website. Characteristics of our participants who took the PSE READI tool, excuse me, 56% were SNAP-Ed and 44% were CHC practitioners. The majority of them, thank you, were female. And 80% were between 20 and 49 years old. And we asked them how long they've been in their position, and more than half of them have reported they've been in their current position between 1 and 2 years, so they are pretty kind of new. As I mentioned, we assigned each participant to a PSE READI tool based on their preference. And 18 participants took the PSE READI tool, but there were 5 people who took more than one PSE READI tools. So the total number of PSE READI tools taken by our usability participants were 25. And farmers market was taken most frequently, followed by healthy eating in childcare and healthy food retail. There were 2 participants who took farm to school PSE READI tool. In our poster survey, we asked a series of questions related to the usability of our PSE READI tools, and I want to highlight some of them. And please note, 1 being not strongly disagree, to 5 being strongly agree on this statement. So overall, we received, I think, very positive feedback. So most people thought that using the PSE READI tool would make it easier and useful to implement PSE interventions. And they also thought the question in the PSE READI tool were easy to understand. Other examples, I want to point some negative feedback also. So there were people who either disagreed or were neutral on this statement, but still the majority of participants thought that they would use the tool again. They felt that they were more likely to implement PSE intervention if they used the PSE READI tool, and they also felt that the tool would help them implement PSE intervention more quickly as well. And we asked 4 questions about the 3 recommendations provided they received upon their completion of the PSE READI tools. The first 3 questions asked whether the recommendations provided relevant and satisfactory information, and if they were clear enough to guide the implementation of PSE intervention. And the fourth questions was about if the recommendation were presented in a kind of useful format. Again, overall, we received positive feedback. However, there were people who either disagreed or were neutral in these questions. And I think both positive and negative feedbacks are important to us. So, and our team really want to kind of explore more about those kind of dimensions through our follow-up interviews. And here is the screenshot of some of the findings from our interviews with 4 participants. Generally speaking, the results were consistent with the poster survey. So most of the feedback was positive. In terms of the overall feature of our website, people thought it was easy to use. Navigation process was easy. The website had good information. And we received a lot of really, really good suggestions for improvement of our website and tools. So I want to pick just one comment here. So it said it will be better to clearly mention that there are many resources available on the website in the report. So I think it's really helpful, and our team will kind of take these comments very seriously when we develop our website version 2. I have another very exciting result. Looks very complex, but just the key message is simple. So Darcy mentioned that one size doesn't fit all. So I think the premise of our BCOP study is that successful implementation of PSE intervention require tailored implementation strategies because communities and practitioners are at different levels of readiness and capacity. And we really want to capture this complexity through our PSE ready tools and help frontline practitioners move forward to make progress. I think the result of this table kind of support that. Why? First, so if you see the overall readiness score that David explained, every user got different score. There's no same score here. So it ranges from 23.56, which is our best score, to 96.73, meaning less ready to implement, in this case, healthy eating in childcare intervention. So the community and practitioner needs to work very hard to move progress. Second, if you see this particular user's result, this user took Farmers Market PSE ready tools, and I want to point out that all 3 recommendations came from different themes. It's not just from one theme about logistical factor. So I think our toolists did very well to capture these different dynamics. And the level of response was, first 2 recommendations were low, and the 3rd recommendation was high. And if you see perceived actionability, in our post-survey, we asked the participants about their perception of how actionable each recommendation would be over the next 12 months, on a scale ranging from 1 being not at all to 10 being very greatly actionable. So this user, although the level of readiness response was low for recommendation 1, he or she feels like, I'm so confident about what to do using the information we provide. But not all people is the same. Oh, sorry. So the second example here, same Farmers Market PSE ready tool, and again we generated 3 recommendations from 3 different themes here, and first 2 recommendations are low in terms of level, and the 3rd one is medium, but for some reason this person feels like less confident about what to do. So I think Darcy may add, but I think our tool did very well to capture the complexity of the implementation of PSE intervention, and we really hope to help these frontline practitioners through this tool and some training models that Darcy will talk to move forward.
So just in wrapping up, where are we going? We're about, like I said, we will release a new version of our website that will have some of the enhancements that Eunlye talked about. There is also going to be the ability to take that assessment as a team, which we think is really important, that all of this work is not about a sole person coming out and leading, but working collaboratively. And then our goal is in 2018, 2019, we'll be doing statewide dissemination. We'll probably go out to about 5 regions of the state for day-long trainings where people will not only have taken the assessment, but then really moving it forward into an action plan with clear objectives, to move those things forward. So just in wrapping up, why this project? I mean, this is a lot of pieces, a lot of parts. Why do we care? I mean, for me, it's ultimately about disparities reduction. If we think that evidence-based interventions are an answer, which I think they could be, the reality is that we're not all entering in at the same place. And so one of my greatest concerns with evidence-based interventions is the widening of the field rather than the narrowing. Because you can imagine that whoever's at number 1 there with 23, that group is ready to go no matter what you give them. And if we have the same expectations for them and we provide the same resources for them as we do for this one, I mean, this is essentially 100 is the worst score. Mm-hmm. We know we're dead on arrival, and I really hope that this kind of thinking can inform not only practice, which is key right on the front line, but it informs at the state level how we even think about programming, how we think about resources, and even for foundations and other groups supporting this work, how do we tailor to the reality of context to, really ultimately, if our goal is to achieve equity, I think if we don't do that tailoring, we know where we will end, assuming that those evidence-based interventions actually work. So that's sort of why I feel like this is such an important project, and have absolutely enjoyed working with my collaborators, and feel excited about seeing where it will go in the future. So thank you, and we are almost out of time, but we do have a little bit of time for some questions.
Yeah. So as a reminder, our seminar goes to 1:15, so if you feel like you have to pick up, but we have a little bit of time.
Any questions? Yeah.
So I'm wondering a little bit more about the tool itself, and is it assessing the practitioner's capacity to do an intervention, or what about the community context? And I'm thinking back to half of the folks that took this were in their job for 1 year. And so how does this tool actually kind of mix those two when we talk about context being very important for the success of an evidence-based strategy?
Yeah, so David showed you the 10 different themes, and those themes map onto questions. So it gets at both organizational capacity, practitioner capacity, as well as the community context. So there's a chance that a person who's new isn't really making a good assessment of context because they don't know.
That's exactly.
So there is an option for don't know. If you score don't know, we'll give you 0. So we'll assume that is the lowest level score. That's also why we highly recommend doing it as a team, because what I might know about my community may be slightly different than my partner. But it is recommendations could focus on building practitioner capacity, organizational capacity, or community capacity.
Okay. So if someone's new, or maybe they've been focused more on direct education, and now they're switching to PSE, they may not even know that there's a farmers market initiative around SNAP, and so that would then impact what the tool would say in terms of that community's readiness.
Yep.
Okay.
Like it may say, have you, try and get connected to some, partnerships in your community around farmers markets. These might be, and they would be examples of like places they would find, like the Ohio Directory of Farmers Markets.
Yes, so I actually would like to build, because that would have been my questions to start with, too. We are talking about team collaboration and statewide intervention, which are great goals indeed to work on. But then when we get to usability and we get feedback with N equals 18 for the state, and we're talking about community interventions, indeed, are there any plans to go forward from this pilot of usability with 18 people to give feedback on the state to have statistical power? And why aren't we looking at people who are working as practitioners? But the best would be so they have been through the system, SNAP and other of these practically, the practical how-tos and what to do's in this. That would be valuable feedback, I think. And then, is there any, are there any indicators of obesity itself? Any BMIs looked at any point? Cardiorespiratory fitness, even measured in field tests such as the 1 mile run times. Are there any in the plan anytime?
Yeah, so let me just start with your first question about the testing. So usability was really, you actually want a small number because if it's not useful, you don't want to have it out wide scale. So our goal was to really get a small group of people to test it out, make sure that a lot of things can go wrong on a website. And so that's some of what our usability. So you're right, it's a small group. We think that while we would never, the results of what we showed you are not publish worthy, kind of thing. They give us a lot of good feeling about the tool, that it's working as we intended it. Our goal in the next year is to roll it out for the state. We'll never have thousands of people taking it because there aren't that many people that are, implementing PSEs in the state. But I mean, hopefully we'll have maybe 100 people taking it next year. That would be great. In terms of the other questions that you had about individual level obesity and physical activity, we do include a report. I didn't show that today, but there's a report that you get about your county that includes some basic information about obesity rates, dietary behaviors, socioeconomic status factors in the community, disease rates, things like that, that help hopefully you think about the broader context of implementation. But our target of intervention is not at the individual level. It's really at the organization practitioner level. And hopefully, they would then be able to measure other outcomes related to the interventions that might be at the individual level.
So it seems like the farmers markets are a huge, important piece of this. But being in Ohio, we're limited with weather. So what has been brainstormed or what can be done maybe to increase the options year-round for that?
Yeah, and I think there are other experts in this room that would be able to talk a little bit more. I'm going to say one thing and then I'm going to turn it over. Maybe Morgan, you could offer some more expertise. But we actually do have farmers markets in Ohio that go year-round. Most of them we have a pretty solid season in Ohio, I would say from March until November. So those winter months where it is a bit leaner, but I think there are a number of really exciting maybe agricultural development efforts that you could talk about briefly trying to push more of the year round.
Yeah, I think one example of that here in Northeast Ohio is Congresswoman Fudge has really tried to leverage federal dollars through USDA that normally go to rural communities for urban communities in terms of food production. And so, gosh, over the past, I think, 6 or 7 years, there's been a major push to do cost share for high tunnel expansion, so providing unheated greenhouses for year-round food production in Greater Cleveland. And there's tons of different urban agriculture projects that have received those to really push production year-round, not only for consumers, but also for the farmers and producers themselves, so they have more steady income throughout the year. And I think the other thing that kind of thinking about that seasonality of farmers markets, and we do have some year-round farmers markets, I think this tool is really about a broad-based strategy that might include pairing healthy retail options with a farmers market. I think farmers markets are probably something that people understand, that seem simple, even though they're not, I'll just say that. Bringing producers together in a public space for 3 hours, 1 day a week seems a little easier or tangible than working with healthy retailers, which might be a completely different domain for someone to work in, or thinking about childcare, or interesting that farm to school was last on that list, because you're navigating an entire school district. So I think these strategies, and I don't know, kind of, Anna Claudia, what you think, I think they're meant to be paired together, so it's not just one size fits all, it's a combination of strategies in a community where healthy food is the easy choice no matter where you go.
Right. Fortunately, one more. And then we'll
this is for Anna Claudia. You mentioned the individual sessions that you had, 3 sessions, 45 minutes, and that seemed to be make a difference. What was the time? How, was it once a week for 3 weeks?
Okay, so the study we did a few years back for best practices, SNAP-Ed, were weekly classes of at least 45 minutes. And we did up to 6 classes that we measure at one-time intervention, because that's what a long time ago we used to do. It's just one time only, 3 and 6. And it took at least 3 classes to start seeing behavior change and reported behavior change.
And how did you get the people in for that?
Well, for the study it was easier. It was more controlled, and we had incentives to be part of that study. We did it in 3 counties throughout the state. But for regular classes, that is a challenge. And I have to admit, our PAs work really hard to get, especially adults, to our classes. As you imagine, these individuals are also dealing with all kinds of different problems, like we all do, plus kids and work, or trying to find work. So coming to our classes may not be probably a good priority. So therefore, we create a system of teaching and engaging our participants, where they come in, hopefully feel heard and feel that they are part of talking about things that they want to hear, and make solutions to some of the things they would like to find problems they have. So our PAs have highly trained throughout our program, especially the first year, to engage and market our programs in a way that once they get into the program, they engage them in a way where they do a lot of activities, cooking, and so hopefully they want to come back. But it is a big challenge. Yeah.
All right, unfortunately, I think we have run out of time, but we have a round of applause for our panel first. To come a year from now, like when this
And we
goes
do
up.
have a couple copies of the paper if anybody is interested.
All right, so thank you all for coming. If you haven't signed the sign-up sheet, please do so.